The COVID-19 situation continues to be dire in the U.S., with an increasing number of businesses mandating vaccinations as infections rise. U.S. government data have now shown that hospitalizations of COVID patients in their 30s hit a new record as the especially contagious Delta variant spreads. Here to provide an update on the ongoing health crisis is Dr. Marco Sanchez-Gonzalez, adjunct professor in Lake Erie College of Osteopathic Medicine's Masters of Health Services Administration and Public Health. Doctor, thank you so much for joining us this afternoon. And I first want to ask, what has the situation been like right now where you are in Florida, especially given the state soaring COVID cases recently?
Well, the situation is becoming very critical, especially for the healthcare system, because as many people get sick at the same time, that means that the capacity of hospitals start to be limited. We have some cases and in some institutions that some of the patients has to be displaced to accommodate new COVID patients. So you add that to the fact that many of these COVID-19 patients, the length of stay is over 7, maybe 14 days. We are creating that bottleneck effect that it's definitely starting to put some strain in the system. And right now, the situation is that even if we can achieve 100% vaccination, we're not going to see the effects of that in less than 35, 45 days, what it takes to the vaccines to make their full effect.
Do we know yet what is it about the Delta variant of COVID-19 that is impacting so harshly on children other than not being vaccinated? Because they seem to have had a resistance to the original COVID.
Yeah, it's a very good question. Mechanistically, what is being shown in many studies is that this virus, this Delta, has a very good affinity to the receptors for infection. So meaning that it makes it easier to get infected. When that happens and it's easier to get infected, you will be able to get, or the virus will be able to get to children that are more susceptible to it, especially those that have other comorbidities. Interestingly enough, many of these children-related hospitalizations are similar to other viral illnesses. So shortness of breath is there. Many of these kids are hospitalized for complications owing to dehydration, for instance. So it's a combination of, yes, it's a variant that is more infectious, and yes, it's spreading faster to kids that are potentially more susceptible to it.
And just in terms of the hospitalizations and the severe cases that you've been witnessing in your area, what proportion of those have been among the unvaccinated versus the vaccinated populations?
So roughly, I want to say the ratio started roughly 90% unvaccinated. But as we go into that number is starting to decrease. That was predicted via the models of the immunity, because the vaccines were basically designed for the Wuhan virus variant. And yes, they still provide some protection for this variant. But as I mentioned before, when you have a faster spreading of a viral illness, you are going to get to those susceptible faster. Still, we have a very important number of patients that are unvaccinated. But even if we reach that 100%, there's a very short chances that we are not going to have hospitalizations, because as the vaccines, they don't prevent the spread, they don't prevent the infection, they prevent some of the severe cases. So right now, one of the measures that we need to start thinking, it's to apply more robust models to follow patients from the primary care perspective and start early treatments that has been mentioned before by the CDC, with some of the treatments that are already approved, such as monoclonal antibodies, that probably we can ease 15-20% of those patients. They are not reaching the hospitals. That will basically help us to ameliorate the burden in the healthcare system.
What information, if any, are you within the healthcare industry and field getting about other variants which may be emerging? Not the Delta variant, but others, because we keep being told that people who are not vaccinated are a breeding ground for new variants.
Okay. So there is not evidence to suggest that has anything to do with vaccination status. Basically, any variant will find an individual and will escape that immune system, whether that individual is immunized or not immunized. So vaccination doesn't mean immunization. And that's another concept that we need to start putting out there, because we can have a vaccinated individual that still is not immune because it hasn't mounted the response to the virus, as opposed to other individuals that they may have resistance to the disease, natural resistance. I'm not saying that they have more protection, but there's some people that is simply not susceptible to it. The viruses will find those individuals that appear not to get sick, and they escape that immune surveillance, whether it's that vaccine induced or naturally. And those are the variants that jump into individuals that, yes, definitely will get more susceptible to it.
Dr. Marco Sanchez-Gonzalez, adjunct professor in Lake Erie College of Osteopathic Medicine's Masters of Health Services Administration and Public Health. Thank you so much.